So we're going to talk about ivermectin, which is semi-synthetic derivative from Streptomyces evermitilis, drug of choice for onchocerciasis and strongyloids. Mechanism of action, we have to remember 3 points. It is microfilaricidal and not a macrofilaricidal. Second point is it acts on a special type of glutamate-gated chlorine channel and causes tonic paralysis in nematode, and this channel is only found in invertebrates. Now, such channel is not involved in the motor control of flukes and tapeworm, so they are unaffected. Third point is that it also has a GABAergic action. GABAergic action is not seen in mammals due to lack of affinity and exclusion from brain by P-glycoprotein mediated efflux at blood-brain barrier. So 3 points are: it is macrofilaricidal and not a microfilaricidal. Second, it works on spatial glutamate-gated chlorine channel, which is only found in the invertebrates and causes tonic paralysis in the nematode. Flukes and tapeworm are unaffected. Third point, it also has a GABAergic action, which is not seen in mammal. Why? Because lack of affinity and exclusion from brain. Now it is also effective in a only effective drug in the scabies and pediculasis, which is single dose of 0.2 mg per kg. Side effect can be remembered from the following mnemonic, which is MET: M for myalgia, E for edema, T for transient ECG change, and T for tender lymph node, F for fever, U for urticaria, and then for PAN-C, which is P for pruritus, A for abdominal pain, N for nausea, and C for constipation. So it goes as MET, FU, PAN-C. Now, safety in pregnancy and young child is not established. So we'll go with the introduction of ivermectin, which is semi-synthetic derivative and the drug of choice. Mechanism of action consists of 3 points: microfilaricidal and not a macrofilaricidal, and then acts on glutamate-gated chlorine channel and has a GABAergic action. Then only effective drug for scabies pediculasis. Side effect: MET, FU, PAN-C, and then for the pregnancy and young child. Pharmacokinetics, 5 points: orally well absorbed, widely distributed in the body but does not enter the CNS. T half-life 48 to 60 hours. It is very long acting drug, metabolized by CYP3A4, does not have any drug interaction. So 5 points are: orally well absorbed, distributed all over the body except the brain, longest acting, I can say it's a longer acting, 48 to 60 hour, metabolized CYP3A4, and no drug interaction. Uses: as we discussed above, we know drug of choice for strongyloids and onchocerciasis, so it is useful for that. Second, for the cutaneous larva migrans and ascariasis, and also for the scabies and pediculasis, 0.2 mg per kg single dose is used in filariasis as well, along with albendazole. In strongyloids, hyperinfection syndrome occurs in immunocompromised patient, so daily treatment can be taken till the syndrome subside. And also now we'll talk about how it is used in river blindness control program of WHO, conducted in Africa and it's conducted in Africa and Latin America. Then it replaced DEC for onchocerciasis treatment. DEC is diethyl carbamazepine citrate, which was drug for onchocerciasis previously, but now ivermectin is used. So first point for the use: strongyloids and onchocerciasis, drug of choice. Then strongyloids, then cutaneous larva migrans and ascariasis, scabies pediculosis, 0.2 mg per kg for all 4 of them, used for filariasis with albendazole. In strongyloid, hyperinfection syndrome occurs. In strongyloids infected in patient, hyperinfection syndrome occur in immunocompromised, so daily treatment till the syndrome subside. Used in liver blindness control program of WHO, and it's replaced by it has replaced DEC for onchocerciasis